Welcome to the Voices of Otolaryngology podcast series, where we spotlight diverse perspectives and insights within the field of otolaryngology. I'm your host, Rahul Shah. Let's jump into it. I am so excited today. I have two new friends that I've been able to meet in my role, and we're going to be talking about sustainability, how it pertains to otolaryngology, operating rooms, private practices. I've been blown away by what these two have taught me and what our academy is embarking upon with their guidance. Why don't we take a moment and get to know ourselves? Dr. Dilger.
Hi, my name is Amanda Dilger. I'm a general otolaryngologist and facial plastic surgeon at Montefiore. I previously was at Mass Eye, where I headed the Harvard Otolaryngology Committee on Climate Change, and have done some sustainability work in the hospital there. I also chair the Academy Sustainability Working Group.
Great. Dr. Tummala.
Hey, I'm a general otolaryngologist at NYU Langone Health, and I've been in the climate change space for the past 7 or 8 years, most recently working on some sustainability initiatives, and I also work closely with the Medical Society Consortium on Climate and Health to work on advocacy and initiatives around how climate change impacts health.
So you both are coming to us from New York City, is that right?
We are a block away from each other.
Oh my gosh, but we might hear dogs, we might hear car honking. That's just the way it is in New York.
Yeah.
It's all part of the fun.
All right. I have met you all. We've had several conversations, and this was my idea to have a podcast because what you're talking about is practical and relevant to practices. Can you give us examples? Let's just get right into it. What can a practitioner listening to you learn from you or do even by next week to impact our sustainability? I'll let either of you go first, please.
I think overall, our big arching takeaway that we want folks to know is that in general, sustainability interventions are good for a practice in multiple ways. So financially, it's been shown that sustainability interventions in general save money for healthcare systems. They also help to increase resiliency in the setting of supply chain issues, increasing extreme weather events, things like this. So there's a lot of co-benefits associated with sustainability. So we recently wrote a bulletin piece that highlights 4 specific examples. So we can go through those, and just give some examples for things to do in clinic.
So I got it. You all had us. And now I want to get into the meat and potatoes. So for example, at the Academy, we're a hybrid. We have employees that remote work, telework, and also in the office. And what we went to was core days. Monday, Tuesday, Wednesday, everybody's together. It's for collaboration and working together. But a huge driver, when I would come in at 6 a.m. on Monday, it was ice cold or 80 degrees. That air had been running all weekend. All the lights were on, and the cost savings have been tremendous, and the environmental impact. Is this what you're saying? Doing the right thing actually helps our practices?
Yes, exactly. And I would say, like the clinical equivalent of that would be the HVAC setbacks in the OR. So, the OR has to have a certain air turnover rate to maintain sterility. But there are lots of hospitals that are already implementing these HVAC setbacks where overnight you have one OR that's still maintaining sterility in case of traumas or emergencies, but the other ORs are scaling back the amount of air turnover. And this is, a big way to save money for hospital systems and to reduce energy use. So and we didn't even go into this one in our 4 specific ones, but that's just another great example of how you can save money and reduce your environmental impact.
A lot of these initiatives just require someone to recognize that there's unnecessary amount of energy that's being utilized and saying, okay, how do we actually change the system so that we are not spending extra money on all of this air conditioning and all of these extra air exchanges? And so it's anything that we're seeing that, again, this is how the hospital system used to run. How can we change it to make it more efficient?
And before we get into the 4, because now everybody's pining for these 4, but it's also the overall waste. Right? It's not just the energy and the cost, but it's the environmental impact of running that HVAC in 19 operating rooms when you only need one for a trauma from midnight to 5 a.m. Right? That's your point, Dr. Tummala.
That's exactly the point.
Yeah, well said. Okay, let's get into it. Let's start. Who's going to start with the first one? I'm so excited. I don't even know what it is.
I can start with the first one. So the first one that we focused on was reducing glove overuse. The reason that we focused on this was a great study just came out from our colleagues, Dr. Lalakia and Dr. Mickeljohn out of UNM and Stanford, where they looked at how gloves, just non-sterile gloves, were being overused, especially after the COVID-19 pandemic. It's being used for things like taking vital signs, administering medications, pushing wheelchairs, things like that, where, there's really no infectious risk. So they did a really nice study out of one of the Stanford hospitals where they followed the Joint Commission policy on glove use, basically just highlighted it to folks that worked within directly patient-facing ways. And they were able to reduce unnecessary glove use in their clinics by 27%. And that was an estimated savings of about $3,000 a year. So that's a great one to target, just so that staff members know they don't need to wear gloves for things where they're not coming into contact with blood or mucous membranes or things like that.
So that's super interesting, and it wouldn't have been where I would have thought, but it makes perfect sense. You're absolutely right? The wheelchair is a perfect example. And you think of the folks around the hospital with transports, probably 1,000 gloves a day. Miguel Ventura from our Academy team helps us with these webinars, and he's off camera right now, but they do a beautiful job of highlighting underneath our names. So he'll provide a link to that bulletin article. So glove overuse, excellent idea. Who gets number 2?
Number 2, streamlining our surgical trays. So we have all been in situations where we're opening up a surgical tray and there are just so many more instruments than are actually necessary for us to use during that case. So the whole idea behind streamlining surgical trays is to cut the excess, basically slim down our surgical trays to have the instruments that we really need. And so there was a single institution quality improvement study that basically removed the instruments from major ENT trays that were utilized less than 40% of the time. So it's not that we get rid of these instruments, it's that we peel pack these instruments to have available for if a surgeon needs those specific instruments for their particular cases, because we all have specific preferences. And what this study found was that over a 3-year period, because you are using less energy, less water to be able to sterilize all of these extra instruments, there was savings of over $220,000 over a 3-year period. And the study also found that there was a 100% surgeon satisfaction rate. Like, how often do we get a 100% surgeon satisfaction rate? But the idea here is if you're going through less instruments, your scrub nurse is going through less instruments, then that improves efficiency in the operating room as well, because there's less things that you're having to look at that aren't actually necessary for that particular case. There was another study that was done at UAB a couple of years ago that looked at cardiothoracic surgical trays, and they similarly found that in just 1 year, they had over $69,000 of savings when they removed unnecessary instruments from those cardiothoracic surgical trays as well.
All right, Amanda, number 3.
Okay, perfect. So this actually transitions well into opting for in-office procedures instead of in OR procedures, because we do have a lot more control over the instruments and the setup that we're using in our own offices as opposed to in the operating room. So for certain clinical scenarios, there's in-office versions of procedures that can be done, and they're safe, they're cost-effective, and they're much more sustainable. So there was a great study in 2024 that looked at in-office surgical laryngeal procedures for recurrent respiratory papillomatosis. And they found that the in-office version generated 13% of the waste that was generated during the OR version. So you're saving a lot in terms of drapes, masks, things like that you may not be using as much of. Similarly, we see like in Mohs surgery for small soft tissue reconstructions, using field sterility in the office is safe. We don't see an increase in postoperative infections, and you can save a ton of money. So you save about $60,000 a year annually when Mohs reconstructions or small benign cutaneous procedures are done in clinic as opposed to the operating room, and no difference in infection rate between the two.
Y'all are encyclopedic. Your knowledge is so deep. And what's striking is you're citing the articles, which is great. There's a lot out there. I mean, it's not soft science. So you said we should look at in-office where possible, because that helps reduce our footprint and promote sustainability, right? All right. So we have glove overuse, streamlined surgical trays, consider in-office or perhaps the site of care. Are we really in the site we need to be? Dr. Tummala, what's the number 4?
Number 4 is working with our anesthesia colleagues. So the American Society of Anesthesiologists has actually put forward some really specific recommendations for lowering the carbon footprint of surgical centers. And there's a lot that we can collaborate with them on. So specifically, desflurane has a much higher carbon footprint than sevoflurane and is actually more expensive. But in most clinical scenarios, the two have an equal outcome. And so a lot of this is just based on education. A lot of other countries have banned desflurane, noting this outsized carbon footprint. And so there was one study that looked at over a 3-year period. Once they got rid of desflurane, there was over $200,000 of savings. And of course, you're going to have a much lower carbon footprint associated with that.
What's the use of desflurane in America? As a ballpark. Do you know how the pie looks for anesthesia gases?
I don't, because I don't know as a whole, Amanda. I don't know if you do. Some hospital systems have banned it or have gotten rid of it, like NYU has. Some hospital systems are transitioning out. Some haven't done anything with it.
Very interesting. Are those the gases also used in surgery centers, or that's your point? Look at where you're using and think about it. Is that it, Dr. Tummala?
That's exactly it, right? Because sometimes you don't even know that the product that you're using has a much higher carbon footprint than a different gas, and also that there's a less expensive equivalent. And so it's recognizing that those two things, in this case, both apply to desflurane, and so it's a win-win situation.
Dr. Dilger, anything you want to add to that?
I'll just say that in addition to switching to SIVO from desflurane, you can also consider total intravenous anesthetic when possible. So that has a much lower carbon footprint than all the inhaled anesthetics. And then specifically for otolaryngology, we know that, certain scenarios, studies have suggested that there are improved clinical outcomes when using TIVA over gases. So for rhinoplasty, less postoperative nausea and vomiting, decreased risk of pulmonary complications in free flap patients. And then the studies are a little bit mixed in terms of sinus surgery, but some of them do suggest increased visibility and less blood loss when we're using TIVA. So that's a reason to consider that as well. The prices of that are a little bit variable from center to center. So unclear if it's as much as a cost saving as just getting rid of desflurane, but definitely some potential clinical benefits there.
Yeah, really cool. It reminds me where quality and safety was in the mid 2010s, where there's a business case, but it also drove improvement in care. So sustainability, you have clearly shown as a business case. You're amazing. You all cited us about 10 articles, 15 articles, but you also showed helps patients. Dr. Tummala, do you want to reflect on that? And has that been an epiphany, an evolution in thinking or thought process?
Honestly, a lot of it just makes sense, right? Like quality improvement is all based on how do we optimize patient outcomes and getting rid of excess waste and making the entire healthcare system more sustainable. It's really great that we have the data to show how beneficial these things are from an economic standpoint. But it's really, again, I think a lot of it just makes sense in terms of how we function as a healthcare system and the outcomes that we want for our patients.
So you mentioned 4 things that otolaryngologists should think about, and we're going to highlight the bulletin article, which was terrific. Glove overuse, surgical trays, in-office procedures, and collaborating with anesthesia. What else is out there? What are other specialists doing? What are other hospitals doing? Looks like Dr. Tummala, you were going to weigh in on that.
Well, I wanted to, before we jumped away from ENT, there was actually a lot of chatter on some of the ENT forums about peel packing instruments in the clinical settings. So that's like the nasal speculums, the instruments that we use for ear cleanings. And it seems like a lot of clinics started peel packing those instruments, possibly because of COVID, like they suddenly just overcorrected and were cleaning, sterilizing, and peel packing these instruments. And actually, our academy and the Joint Commission have issued a statement saying that you don't necessarily need to peel pack these individual clinic instruments as long as they are cleaned and sterilized and stored in the proper manner. So part of the reason we didn't include this as a part of our paper is because we don't have really good data yet to show the cost savings. But there has to be cost savings. We're working on getting the data together now. But basically, if you're eliminating the amount of time that the medical assistant takes in having to peel pack each of those clinic instruments, also the amount of time it takes us to open up each of these instruments once they're peel packed, and then the peel packs themselves, it's hard to imagine that the cost savings won't be substantial.
Yeah, I don't. That passes the sniff test in my mind. Right, we don't need a randomized control trial to tell us to wear a parachute when we jump out. I appreciate you all with the science, but I don't think you're going to have a big uphill battle convincing people that it's a waste of time and resources. And I like the trifecta there of the environmental impact. Honestly, I hadn't really considered that until you brought it home there. You're literally, it's plastic and you're wasting it. So great point, Dr. Tummala. Dr. Dilger, did one of you, Dr. Dilger, maybe you can take it. What else is out there in otolaryngology? What are other specialties doing? Dr. Tummala brought us back to otolaryngology with peel packs, but what's out there?
Yeah, I think one of the things that we've been talking a lot about is the single-use disposable instruments, in particular the single-use disposable laryngoscopes. So there has been a very well done life cycle assessment, which is calculating the amount of emissions and waste associated with reusable versus disposable scopes. That was in the laryngoscope a couple of months ago. It showed that there's a higher environmental footprint for the disposable as opposed to the reusable scopes, which is not surprising because they're almost entirely made of plastic. But there wasn't a good assessment of the cost savings in there. So we don't have good data on that yet. But in other specialties like anesthesia, for example, they've looked at the intubating laryngoscopes, and for the disposable versus the reusable, when they're using the reusable ones, they save almost $1 million a year in certain hospitals. So it does seem to suggest in general, the reusable options are the more cost-effective options.
Dr. Tummala, do you want to add to that? Other specialties, maybe urology, orthopedics, family practice, what are they doing out there that's exciting that you all want to bring to our field or to your operating rooms or to your hospital?
So one of the big areas is also in the operating rooms, making sure that we reuse instruments. And so Stryker has a really great reusable reprocessing and re-sterilizing instrument setup, and they will reprocess instruments that aren't just Stryker instruments. And so other companies do it. It's more that I'm just the most familiar with Stryker. And so working with companies that are doing that and reprocessing instruments that can be safely reprocessed. And one of the nice things is, so Stryker, every instrument that they reprocess in their facility, they test it to make sure that it's still an effective piece of equipment. Versus sometimes equipments that come out or pieces of equipment that come out that are new, not every single one is tested. They're usually batch tested. And so there's a lot of reliability here, and you're also giving specific instruments more than one life.
Wonderful. I love that. Dr. Dilger, did you want to add to that?
No, I don't think so.
You don't have to. It's okay. I never want to take away from you all. I'm going to do a contrarian ask, and I'm going to flip this a little bit. I like always asking what could go wrong, what can we do better, what are we not doing? So let me ask you, where have we gone wrong with sustainability? How about in the last year? How about in the last 5 years, where you say, we initially thought X was a good idea, but we realized we were wrong. We initially thought that reusables were better, but then we switched over to single use. That's an absurd example. I get it. But what have been some lessons learned, or where did we go wrong? What didn't go right?
I would say one example that comes to mind of what didn't go right is actually how we talked about it. And so there was a study, it was from a hospital in Michigan, and basically they were looking at the anesthetic gases. And the way that it was framed was basically saying that you shouldn't give a certain anesthetic gas to patients because it has a much higher carbon footprint. And I think what was lost in that messaging was that the clinical outcomes is not impacted. But what people immediately took from that is, oh my gosh, I'm not going to get as much anesthetic gas just because of global warming, just because of climate change. And if you really look at the study, that really wasn't the intent, but it got a lot of backlash because of the message that people were thinking that their care was going to be compromised because of sustainability initiatives. And so anything that we do, patient care, quality of care is number one, the most important thing. If there's an instrument or something that you like that is more wasteful or has a carbon footprint, but you feel more comfortable with it, of course, that's what you should use over something else. And so that messaging and the way that we talk about this has been, I think we've been a lot more intentional about making sure that everyone understands that quality of care and patient care is number one.
Mm-hmm. Dr. Dilger?
Yeah, I would have to agree. I think that's, the biggest misstep. I think initially when we both started with this, we led with climate change as a public health issue, which it absolutely is. But I think bringing it back to things that feel more manageable for people, because when you think about tackling climate change, it feels like such a big problem. And is it something that we can do as individual practitioners? But when we turn it to sustainability within our own healthcare institutions, we gave 4 examples here and then listed a couple more as well. There's, low hanging fruit for every institution that accomplishes the goal of sustainability, which we hope, at large will over time reduce the global warming potential and reduce the emissions.
Yeah, I will be fully transparent because that's the way I roll. When I met you all, I said, what is this going to be about? Finally, we got to get connected. And I'm like, oh, this is not going to be practical. It's going to be 40,000 feet. And I was stunned by how practical it is. So kudos to you both. And you're going to tell me about the committee and the folks behind you, because you're on the podcast, but there's so many people behind you doing tremendous work. I'm going to underscore your knowledge is amazing. And thank you all for just pulling these citations and articles, because it's what we need. And it helps people understand that there's a science behind it. Who are the folks behind you? You work in groups? Is it the hospital or other committees? I know you have a large team that you all partner together to make sure we move the dial on sustainability within otolaryngology, surgery, and our hospitals at large.
Yep. So for the Academy Committee, there is about 8 of us, and we're at a number of different academic and private practice institutions across the country.
So that's Academy. How about in your hospitals or other work that you all do?
Yeah, so I'm lucky at NYU. They have a really robust sustainability department. And so I've been partnering with them, especially on the reprocessing of instruments with Stryker. And I also have really tremendous support from my chair. And so the getting rid of peel packing instruments was an initiative I took on when I started here, worked with our infectious disease control team, was able to get all the approval of steps to move forward with that. At my former institution, George Washington University, I started a sustainability team there. And so they're still, meeting and talking about hospital sustainability initiatives. So sometimes you got to start things yourself. Sometimes there's more and more sustainability departments popping up. And so it's really great to join in.
2 more questions. What are you all working on? You have really helped our field. We're so grateful for you. I love these 5 tangible ideas. What our appetite? What's around the corner? Dr. Tummala, you mentioned the economic analysis and time studies of peel packs. That's going to be awesome. What else is out there that you all are thinking about? If you can tell us, Blue Ocean, what are you thinking about?
So I think from my research perspective, I'm also looking at how these climate variables and how the environmental impacts impact our otolaryngology patients specifically, because there's a lot of data for pulmonary issues, for cardiovascular issues, but not as much for oto. So there's a lot of great papers on allergy and on sinus disease. Our group at Harvard published a paper a couple of months ago on PM2.5, which is a type of air pollution, putting patients at higher risk for head and neck cancers. So I think showing how, these sustainability interventions in the long run will also benefit our patients by reducing their environmental exposures to pollutants is going to be a nice way to tie everything together.
Agree. Yeah, I think more data. So I'm working on right now a couple of different ideas we've always done things a certain way in the operating room, specifically wearing gowns and gloves for putting in ear tubes and stuff. But do we really need to be doing that from an infectious disease standpoint? And so really trying to understand that some of the things that we are currently doing, is this actually the process that's most beneficial for patient health, for infectious disease outcomes? And so trying to really understand those things. There's a lot of different people from our academy group that are working on similar ideas of, again, trying to get that research out there. And the second part is, for us as a specialty, what are the things we should be thinking about? So as Dr. Dilger said, allergy, sinusitis, we just published a scoping review in laryngoscope about how climate change impacts allergic rhinitis. I think this information is really important for clinicians to be aware of, because it helps us guide how we're talking to patients about when they should be starting their allergy medications, potential triggers that might be making their allergies worse. And so making sure that we as a ENT community are also fully aware and knowledgeable about what's going on.
Yeah, super. You're going to become very popular, Dr. Tummala, where you're doing these studies that help our practices reduce what we have always thought about silly, doesn't make sense, but you're framing it from the correct lens of how it ultimately can help our patients and our environment. Dr. Dilger, loving the climate impact on patients. We have a whole team here at the Academy, Jackie Cole, Miguel Ventura, and Christopher Harris, and they all help us think about these podcasts. I'm going to ask you all, every time I talk to you both, I get more and more excited, and I always invite you to do more things, but I do think we should do another podcast, and I think you probably suggested it to me, but I didn't hear you, on how does the climate impact our patients? Mm-hmm. Let's just stop right there. How does the climate impact our patients? I think today we've talked about sustainability strategies for the otolaryngologist, but we'll make a note and have you all back if you don't mind, because I think that's really important. Why don't I leave us with one question? I'll say it and answer it, but you both have to have a better answer than me because I'm giving you a second to think about it, okay? What advice do we have for our listeners? We have about 5,000 to 7,000 listeners that will listen into this podcast. Why don't I go first? My advice, it's not esoteric, it's not too hard, just do it. Right? Think about desflurane. Do you really need it? You've made a great point. I'm going to ask myself that. I'm going to look at my glove overuse. I hate my surgical trays having 27 instruments when I only probably need 4. I'm going to think about bringing in-office procedures where I can to the right site of service, and I'm going to be thinking about reusables. So these are all things that we can do. How about Dr. Dilger, then Dr. Tummala?
I would say start with talking with the team at your surgery center or at your hospital, because it's very possible that some of these things are being done already. So you just want to, focus your efforts on things that they haven't tackled yet, or where they could really use a surgeon's input in trying to push initiatives through. So, it's a multidisciplinary process to get all of these things through. And so, check in with the team at your hospital, see what they're doing already.
So I recommend starting small, and you really want to look around and see where the excessive waste is, where the excessive energy usage, and starting there. So peel packing of clinical instruments that don't need to be peel packed is a classic example. And really working and getting to know your infectious disease protocol team is going to be beneficial to pushing forward many of these sustainability initiatives.
Yeah, perfect. We always look for titles, and it's fitting that at the end of this, we got to a title, maybe something like Sustainability for Surgeons. Start small, collaborate, and just do it. I want to thank you all very, very much. One of the joys of this role is getting to meet new people and seeing the passion for your work. I love how you're framing it. How does sustainability help our practices? Much gratitude to you all. Your knowledge is absolutely encyclopedic. You're like open evidence, PubMed, and humans put together. Thank you both very much.
Thank you so much.
We hope today's episode sparked some fresh ideas. If it resonated with you, please subscribe and share it with friends. Have thoughts or suggestions? Use the feedback form in the show notes. We'd love to hear from you. And don't forget to follow us on social media for highlights, behind-the-scenes content, and updates. Thanks for listening. See you next time.